Okay, let's dive right into this incredibly fascinating new Lancet study. It untangles the complex and, honestly, surprisingly fragile state of the global HIV epidemic. Today's explainer takes a hard look at data spanning all the way from 1990 to 2023. We hear a lot of sweeping statements about the war on HIV, right? But when you actually break down the numbers, the story is way more nuanced. It's a story of monumental victories, sure, but also some deeply concerning regressions and a looming financial threat that could literally undo the whole shebang.
So here's the game plan for today. First, we'll look at decades of fragile progress. Second, regional spikes and setbacks. Third, the danger of IPV. Fourth, the funding cut crisis. And finally, protecting our global gains.
Section 1. Decades of Fragile Progress. Celebrating a global health triumph.
Think back to the early 2000s. It was a really dark time for the global HIV epidemic, but thanks to incredible human ingenuity and international cooperation, we saw a massive turnaround. Global HIV deaths plummeted from a devastating peak of 1.71 million in 2004 down to 0.83 million in 2023. I mean, just pause and think about that for a second. We've essentially cut the global mortality rate in half. That's millions of human lives saved, families kept whole, and communities preserved. This is largely driven by the widespread rollout of antiretroviral therapy, and it is without a doubt one of the greatest public health victories in modern history.
Now, this next number might throw you for a loop. 42.4 million people were living with HIV in 2023. That's actually up from 26.3 million back in 2003. In epidemiology, you usually think a rising prevalence number is bad news, right? But actually, scratch that. This is a brilliant success story. It means people are surviving way longer. Thanks to antiretroviral therapy, or ART, an HIV diagnosis just isn't the death sentence it used to be. People are managing the condition, they're living full lives, and that's exactly why this overall number is going up.
And you know who led the charge on this? Sub-Saharan Africa. Historically, they've carried the absolute heaviest burden of the epidemic, but their response over the last 2 decades has been nothing short of staggering. We're talking a 64.3% drop in new incidences and a nearly 75% drop in mortality. To put that into perspective, countries like Burkina Faso saw massive 90+% reductions across both new infections and deaths. It totally proves that when you have targeted resources and strong care frameworks, you can absolutely shift the trajectory of this virus.
Section 2. Regional spikes and setbacks. A divided world. But before we pop the champagne, we have to acknowledge that this progress is absolutely not a global guarantee. Those global averages actually mask some deeply concerning regional realities. Just consider this stark contrast. While sub-Saharan Africa defeated the curve with that 64% decline, Central and Eastern Europe, along with Central Asia, saw a horrifying 232.1% spike in new incidences, alongside a nearly 38% rise in mortality. The epidemic isn't winding down everywhere. In some places, it is accelerating at terrifying speeds. So, what exactly is driving this catastrophic surge? Well, in places like Russia, where incidences jumped a staggering 371%, it's a complex web of behavioral risks and systemic barriers. We're looking at unsafe injection drug use, plus increasing transmission via sex between men. But it's not just the behaviors themselves, it's the environment. Legal and social barriers are effectively disenfranchising key populations. When you throw intense stigma and the fear of legal repercussions into the mix, people simply stay away from care. The result? Massive underreporting and way lower testing coverage.
Section 3. The danger of IPV, the hidden complication.
Now, let's zoom in from those massive regional trends to an insidious, intimate shadow that is disproportionately harming women. Intimate partner violence, or IPV. It's an absolutely critical factor that this Lancet study puts right in the spotlight. To really grasp the data, we need to use the study's specific parameters. We're looking at the lifetime prevalence of physical violence, sexual violence, or both by a current or former partner for women 15 and older. And we have to be clear here. We aren't just talking about a social or criminal justice issue. We are looking at IPV as a fundamental epidemiological risk factor.
IPV is a direct driver of the HIV epidemic, essentially forcing a 3-step path of vulnerability. First, you have the direct biological exposure that comes from trauma during sexual violence. Second are the indirect structural pathways. The power asymmetries created by abuse severely constrain a woman's agency to do things like negotiate condom use or refuse sex. And third, even if a woman gets diagnosed and into care, IPV severely disrupts that treatment. The data is clear. Victims are half as likely to adhere to their antiretroviral therapy.
That leads directly to virological failure and ultimately higher mortality.
And the math on this is just horrific. 10.7% of the global HIV mortality burden for women is directly attributable to intimate partner violence. Let that sink in. That fraction translates to over 40,000 completely preventable deaths in 2023 alone. These aren't just statistics. These are women who might still be alive today if they lived in environments free from violence and coercion.
Regionally, there is a staggering concentration of this burden. Take Oceania, where nearly a fifth, 17.4% of all female HIV deaths are tied directly to intimate partner violence. Central and Eastern Sub-Saharan Africa are right behind them. This data proves, without a doubt, that we simply cannot end the HIV epidemic among women without simultaneously tackling the epidemic of gender-based violence.
Section 4. The Funding Cut Crisis. A ticking clock.
Seeing how fragile things are for women, we need to zoom back out to a looming macroeconomic disaster heading our way between 2025 and 2030. You see, the entire global response rests heavily on international funding, mostly from a few major donors. But due to expected cuts in that funding, specifically shifts in U.S. foreign aid like PEPFAR, we are staring down a projected 8.1% decrease in global ART coverage over the next 5 years. Remember that 42.4 million success story we talked about earlier? That relies entirely on uninterrupted daily medication. If the funding dries up, supply chains halt, and clinics close.
And here's the crucial point. When health systems and international aid collapse, women bear a deeply disproportionate burden of the fallout. Looking at the projections for 2025 to 2030, we can expect 1.6 million new female infections compared to 1.3 million for males. As for mortality, we were looking at nearly 800,000 women losing their lives. The gender inequalities we just discussed, they're only going to be magnified as resources dwindle.
At a national level, we are looking at total devastation in highly aid-dependent countries. Take Sudan, for instance. They're projected to see a catastrophic 66.9% decline in ART coverage. Meanwhile, in Mozambique, the projected drop in care could result in over 547,000 new female infections and over 134,000 female deaths. These are countries that finance more than 80% of their HIV care through development assistance. When that assistance vanishes, the firewall against the virus collapses right along with it.
Section 5. Protecting our global gains.
So what does the data tell us we absolutely must do to prevent this backslide and actually hit those UNAIDS 2030 targets? Because look, while the projections are grim, they are exactly that, projections. They represent a future we can still change if we act on the evidence. The study advises a strong, multi-pronged approach. First, we urgently need to protect and stabilize the international financing that built our fragile victory. We literally can't take our foot off the gas now. Second, the medical and the social have to merge. We need to integrate violence prevention and post-violence care directly into HIV treatment. The data demands a shift to trauma-informed sexual health services, recognizing that a patient's physical safety deeply impacts their medical outcomes. And finally, we have to build gender-responsive, resilient national health systems.
Which leaves us all with one vital, looming question as we march toward 2030 and face these impending funding cuts. We have the data. We understand the incredibly complex social and biological drivers, and we know exactly what will happen if we pull our support. The science has brought us right to the edge of a historic victory. So will we protect 2 decades of progress, or are we going to watch the gains slip away?